We're in the cusp of some big health changes here in the US. If you didn't know, the US spends around 20% of its GDP on healthcare, with considerably worse outcomes than all other OECD nations, which are just wealthy nations. A lot of this has to do with the historical lack of investment or disinvestment into public health and other prevention, like infrastructure and systems here. And with the changing administration, we have seen that their view of health and how the government plays a part in health is not as significant, which is going to lead to the people that are most in the margins continuing to be in the margins and a whole host of people, millions of people without healthcare coverage, which is, if you've studied public health, you know how drastic this is going to be. And without access to healthcare, people use the most expensive forms of healthcare. So this doesn't make sense in a lot of ways. Hi everyone, Omari Richins here, CEO and founder of the Public Health Millennial, and here to talk to you, I guess, just some of the thoughts on my mind as we're on the cusp of this big, beautiful bill passing. I think there are a lot of considerations and things that we have to think about as we are public health professionals working for the most impacted communities, the most impacted people, and understanding what this impact might have for those communities, as well as what that impact has for us and the health landscape. We have already seen, it's June right now, July when you listen to this, just how devastated a lot of the health jobs, public health jobs, global health jobs have been with a lot of the shifts in the administration and their focus. But what we're seeing now is what I would call like a straight out attack on some of the most marginalized communities and populations. If you didn't know, Medicaid is one of the big things that they're trying to get rid of and reduce to a large extent. Medicaid covers 1/5 of the US population with health insurance. And according to some analysis from I believe it is the Center on Budget and Policy Priorities, there's going to be a loss of around 8.6 million people from healthcare coverage. And in addition, there's going to be new work requirements around Medicaid, which a lot of research has gone in to show that these are not effective and these are not beneficial to what we are trying to achieve in a lot of this work. And it's estimated that 9.7 to 14.4 million people are at risk of losing their Medicaid coverage by 2034. This is a drastic reducing of the access to healthcare, which is essential in many regards for a nation to be thriving and healthy. And it's really sad when we see leaders of a nation create policies to push those persons even more into the margins and just create more obstacles and barriers for communities to access healthcare, especially considering that we are one of the richest nations in the world, a powerhouse, some will say, and yet we don't find value in taking care of our most marginalized persons. And it's clear, and it will become clear to, I think, more people as we see this roll out and this reduced in safety net for a lot of folks is going to be devastating. I can't overstate that. It's going to be devastating. And my heart goes out to all those communities that are going to have to deal with these ramifications and implications, and just know that while all of this turbulence is happening, the work that you do in public health, no matter small or large, is so important. And we need you to continue to do this work and to continue to stand up alongside these communities and continue to work to advocate so that we do have policies that protect and give people access to the best kind of health that they can have. Another huge implication of some of the things in this bill is that it's going to increase food insecurity, as it's going to add work requirements to SNAP and just make it harder for people that are struggling. And I can think about a lot of the people in rural regions who already have a hard time accessing fresh and healthy foods are going to have even harder times. And considering where we are economically and how difficult it is for an average person to live, people that are below average in terms of income and salary and wealth and all of this are going to struggle. And you would think that a government is there to support its people and really create opportunities for them to thrive and to access the things that are so important for them to live a healthy life: food, healthcare. But I don't know where we are as a country to come to this point. So I'm not really sure what to say there. I'm not really sure. Some other things that you have to consider in this bill is that there's going to be a large reduction in environmental regulations, which can lead to higher respiratory illnesses, heart conditions, and other diseases of the environment. And if we look at anything environmental justice related, we know that the communities and the margins are the ones that are most impacted. The indigenous communities, the Black communities, the Latino communities are the ones that are most impacted. So I say that to say it's tough for all of public health workforce right now looking for jobs, especially if you're in early career, with the influx of people that have lost their jobs looking for the maybe likely the same jobs that you are looking for. And now we have a layer on top of that where the communities that we are and have been working to improve the health are going to struggle because of the large scale policies that are in place. And I think it's just really interesting where we are as a country. And I also think that we need to just continue to stay steadfast in the work, in our mindset, in our lens, because this too shall pass. What the implications and ramifications are going to be, I read out some of the numbers. Like, it's going to be astronomical, the devastation it has to so many communities around the US. And I'm just hoping that there are ways for us to build an infrastructure so that these kinds of things don't happen, or it's really hard to happen, because while people who have means are able to survive and to live life, those that do not have means and those that are in the working class are going to continue to struggle unless we are able to really step up and create and speak to a system that ensures that those people are able to thrive and aren't going to fall through the cracks, and are policies and systems and programs in place to support communities, especially when it's needed. And when I think about this, I think about the Medicaid work requirements that are coming in light of this bill, which are going to create even more barriers for folks and more bureaucracy and increased turnover of people without access to health insurance. And if it's one thing you learn while you're studying public health, is that when people don't have health insurance, they forego getting care until things are elevated to emergency, where they have to access care in emergency rooms in ways that are most expensive, when if there were systems in place to track and prevent and catch things earlier on, it's a lot more affordable, and it gives you a lot of leverage in ensuring that persons that are in the margins have the ability to get caught, quote unquote, when things are in the early stages. So it's really devastating, especially considering that there has been a lot of research into Medicaid work requirements and SNAP work requirements and just work requirements around federal programs, and specifically around Medicaid. It has been shown that Medicaid work requirements do not significantly increase employment rates, aka meaning it is more of a barrier than something that is effective in actually working to increase employment rates. And when we think about, you think about the life that you're living and think about the hardships that you have in your day to day. Now think about someone that is living a life on a salary of $20,000, $30,000, and what that means for them when you create a system that has more bureaucracy for already struggling people that are in the margins. This is going to impact older adults, people with disabilities, and caregivers to a large extent. Some of the people that are already struggling, already having a hard time with healthcare, are going to have to go through more hoops, more barriers to be able to access it. And it's going to be a devastating time. It is going to be devastating. Like, I wish I could say something more positive, but there's nothing positive here. Medicaid is supposed to help and support the most vulnerable by providing healthcare access to these to low income individuals. But work requirements undermine this by creating these unnecessary barriers. An example in Arkansas, more than 18,000 people lost Medicaid coverage within 7 months of implementing work reporting requirements. And when this was extrapolated out, that created that 9.7 to 14.4 million people at risk of losing Medicaid coverage by 2034 that I stated earlier. So we can't, whenever I think the public health lens is, okay, this issue is impacting me, but bigger, it's impacting the community. And who are the people that are having a hardest time accessing the systems that we have? And that's the kind of lens that you have when you do public health. And I think we just need to continue to think, how can we create a system that has less barriers and gives people access to the resources that they need to live healthy lives and to be their fullest and healthiest selves. And healthcare is a basic necessity in this. Food is a basic necessity in this. And with these programs shifting so much, people are going to fall through the cracks. The ripple effect of this is unknown. I know there's analysis and people are making models of what might happen, but we all really don't know. But we do know it's going to, in fact, impact those that are already being impacted by all the challenges of day-to-day life. And when I think about a thriving public health system, when I think about a thriving health system, I think about lessening those barriers, creating more access points and resources for those people that don't have access, don't have resources, creating opportunities to health, to healthcare, to recreation, to all the things that are essential. And we need to continue to advocate for this because I think this is one of the lenses that is so important. And even though public health is talked down upon, the investment in public health has been abysmal. We need to continue to talk about the importance of it and continue to advocate for it with our local representatives, our state representatives, and continue to raise up candidates and leaders that are supportive of creating a better system for those that are in the margins, for those that are impacted by these health issues and are going to continue to be impacted because they have been historically disinvested and historically have not been given access to resources, whatever that might be, which just creates inherent barriers within their lives. So while more people are going to be pushed into the margins with no access to healthcare, hospitals that rely heavily on Medicaid patients and payments may struggle, which may lead to even more layoffs in a healthcare setting. We have to stay optimistic. We have to be hopeful. We have to know that though things are bad now, there's always a way to improvement. There's always a way to collectively come together and say, you know, this isn't what we want as an American people. And I think at this point in time, we have to continue to bridge that conversation between ourselves and people that might have differing opinions and find the similarities in this. Because I would be lying if I said that the system last year, 2 years ago, was working. Of course, it was working a lot better than it is going to work with all of these requirements and shifts. But I think that we can agree that the system 2 years, 3 years ago still needed major pushes. And we need to continue to stay on top and say that we aren't going to let these politicians stand and destroy the health of our nation, the health of the communities that are most in the margins. We need to continue to stand up. And I know it's hard. It's hard when you're in a position where you feel like your back is against the wall, where we're in roles where we can't speak out about equity, where things are where they're taking out health equity data and taking out stratification of data, which is going to create research issues and issues in how we understand what is happening in certain populations. And to that point, tailor interventions and programs and policies to better serve those populations. So I say this all to say, I don't know what's going to happen within the next year to 3 years. I know right now things are looking very bleak, that those within the working class that are already struggling are likely to struggle even more. And I don't think this is a honest reflection of the US as a country, or maybe it is. Maybe it is. Maybe this is what the country wanted overall, and maybe we need to take a look at that and say, is this really the country that we want? Is this really the country that we want to live in, where people that are struggling are going to continue to struggle? Or is it a country where we are so resourced that we provide opportunities and access to those that are most in the margins? And I hope that we're in the latter of those two, and that we see just how devastating this is, and that in turn creates an entire shift in how we think about prevention, how we think about public health, how we do this work, how we ensure that those populations that are in the margins are given a voice, are given a way to shape the systems that are around them. Because all of the answers, I believe, for health improvement are locked away in the communities that we are learning to build power around. And we need to continue to build power around that. And we need to continue to advocate and organize. And I'm not sure what organizing or advocating you've been doing, but I think the first thing that you can do is just have conversations, continue to have conversations with like-minded folk, have conversations with folks that have different thought processes with you, and really try to understand where they are and where you are and where we can get to a common ground. I think we need to continue to create that space. And I will try to continue to create a space where persons in public health can connect, because I know how difficult it is to be in public health right now, especially as an early career professional, someone who recently graduated. But keep your head up. Keep your head up. There are going to be opportunities for you to use your lens, use your experience, use your skills to really move things forward. And in order to meet that opportunity, I think you really have to keep your head up and keep your eyes open to opportunities that are new, different, non-traditional, but are still impactful for the communities that need it, and impactful for us doing the work that we find meaningful. Yeah, guys, it's kind of just talking off the top of my head. Wanted to do a more deep analysis, but didn't have time. Just some thoughts on some of the political landscape or the policy landscape right now. And I think that we need to continue to come together to have conversations, to lift one another up as things are challenging, and continue to share resources. And I hope that I'm a resource. I've been some sort of motivation or inspiration as you are navigating these tough times. I know sometimes I find it hard to stay positive, and I know that I do have to stay positive because so many people are looking for a positive light. And in that, I will continue to be that light as much as I can. I appreciate the people that do reach out and share messages on how helpful or motivational this has been, because as you know, it can be difficult sometimes. But I'm looking forward to what the public health millennial can share and can build going forward into this more time of uncertainty around health and health infrastructure and public health. But just know that I'm here for you all, and I want to continue to work to create a better system, and I hope you do too. And let's continue to work on that. Despite what is happening on a federal level, we have to know that this work continues, and all the work that we do, small or large, is important. And never discount the work that you're doing, because it has an impact, and the communities and the people that are feeling that impact are so appreciative for that. And we need to keep going. There's a lot more work to be done, and evidently there will continue to be a lot more work to be done, at least in the near future. But I will leave you with, just keep your head up, take some time to enjoy summer. Remember that life is more than public health, more than your career. You are more than the job. If you're continuing to job search, tailor your resume. Join my community where I'll be hosting some more resume events, and there are opportunities out there for you. It's going to be challenging. It's going to take time, but this work is so important, and you are so important in doing this work. So thank you for committing to whatever level of public health work you have committed to, and I appreciate you. I thank you. Pass that thanks on to someone else in public health that you think needs it, because oftentimes it's a thankless field when we're doing so much work. So really take time to center yourself while all the things are happening around you. You are important. Your whole self is important. So yeah, this is a little bit of a rant, I guess. I don't know. I hope you all enjoyed. Hit that like button, subscribe, share this with someone. Let me know what you thought in the comments below. Very excited that the Public Health Millennial is onboarding interns right now. So I'm looking forward to introducing them to you all and sharing more about their thoughts and insights. But thank you all for the support. Keep your head up. I'm here for you. Be here for someone else. Peace out, everyone.